Hello, everybody. Welcome to day 9 of my personal challenge to myself to ask questions about birth. To go on live here and ask questions, see what you know, ignite your desire to want to know more about birth. We do have a maternity care crisis in the United States. We have a rising maternal death rate. Our infant mortality rate is very high. There's no excuse. There's no real good reason for this, and there are many reasons for it. My question of the day, this is Betsy at Birth in the Know, and my question of the day is, did you know that epidurals negatively affect successful breastfeeding? Yes, the epidural does pass through the placenta and to the baby. Now, I'm not a scientist or a statistician, a statistics data person, although I do read it and decipher, and I rely on other people that are a little bit smarter than me when it comes to that to get my information. And there's a whole book written about the birth practices and how they affect breastfeeding. Linda Smith, one of my mentors that I've known, she wrote a great book, Impacts of Birth Practices on Breastfeeding. And I'm here to say that epidurals, which are widely used, which the majority of U.S. women get for pain relief, which actually doesn't always work 100%, which is another story. But it does affect the baby. I've actually worked with babies that have trouble suckling, and some never learn to suck. Now, here's the thing about that, is that babies want to suck, know how to suck. It's a comfort, it's a safety for them, and it's something that they know how to do. And so why wouldn't they be able to suck after birth? They want to suck, they want to crawl to the breast, and they want to breastfeed, that instinctually. Epidural messes this up. It messes up the natural balance. That's my way of saying it. Point is, well, sometimes we come across a baby who's sleepy. No, they're not sleepy. They're drugged. They are affected by the drugs during labor. And I'm here to say that I want people to know that that's a fact. Hey, Onita, I did not know that till after my first child. Yeah, well, this is the thing. So these things that I'm sharing, these questions that I have, I didn't know all this when I had my first. I did not have an epidural, but I do know that when I did a few years as a birth doula, it was a mixed bag. Some women did get epidural, some did not. However, I have worked with babies who have had trouble suckling, and now it could be something other than the epidural. Okay, so let's give it that. However, that does have an effect on breastfeeding, and I'm here to share that with you. This is another episode of my Did You Know? We know what we know when we know it, and I believe that it's whatever your role and mission and purpose is in this world, it's your job to share what you know that could support somebody else, or and that's why a lot of us get into this birth work and become doulas and childbirth educators. It's because of our own experience, whether it was a beautiful, awesome, amazing birth, which is possible, or it was something less than that, and we don't want other people to have to go through that. I'm here to share facts, share my knowledge, share what I know. I love to pose the questions. Question today, did you know that epidurals negatively affect successful breastfeeding? And yes, the answer is yes. It's interesting how we're told all through our pregnancy what we should not ingest and do to our bodies and drugs we shouldn't take, and then it comes to the birth and, hey, which drug do you want? Here, none of it's going to affect you. Take your pick. And yes, many women go for it, and I'm not judging those women. I'm just here to say that knowledge is power, and there's also this whole knowing from within, and it gets to be a mix of that before you step into this amazing, beautiful, transformational process that we call childbirth. My job is to pose the questions and get you thinking. That's all. That's really what I'm here for. I love to hear from you, what you have to say. What do you know about birth? What do you know about epidurals? If you're about to give birth, I'm holding on to this thing because I feel like it's not straight today. If you're about to give birth, or you're thinking about becoming pregnant, which to me is the ideal time to learn about this stuff, just know the facts. Know what's what. Ask the questions. Ask yourself the questions. Ask other people. Turn to people that are smarter than you. If you doubt something, follow up on that instinct, that gut. That's going to guide you with your motherhood totally. And I'm here to say that knowledge is power. Epidurals do affect breastfeeding, and just be aware. Be aware of your options and your choices and your right to say yes or no, and know what you're saying yes or no to. And I covered that yesterday with informed consent and informed refusal. No, I think I did that on Saturday. Thanks for listening. Thanks for watching. I don't know. I keep changing the time on these things because my schedule is always shifting. I get to be consistent, but it's all good. You might watch this later. Whenever you do, hopefully you'll learn something new, or you'll doubt what I'm saying and you'll explore further. That's always great too. I will be coming back tomorrow. This is a 14-day challenge. I don't know what's after that, but I'm working on a few other things and other ways to share what I know, and I feel like sharing because I want things to shift with birth, and I didn't know these things that I'm sharing before I gave birth the first time, or even maybe the second time. I knew more. So I'm here to share it with you so you can get to the information. Oh yes, well, you're welcome for sharing. Of course, it's what I do. I want you all to have a beautiful day. It's cool and breezy in my woodsy office today. It's actually really nice here in Florida right now. It's that weather where you get to put a sweatshirt on in October. Well, thanks for watching. Enough of my spew. Ask the hard questions and know that epidurals affect breastfeeding. Think and learn before you choose, and then choose. Whatever you do, as long as you are informed. That's what I want for you. Have a beautiful day and enjoy whatever you're doing, and find the peace and turn inward for your answers. Many of them you will find right there. Thanks again, and talk to you tomorrow.